Today we're going to be demonstrating how to pre-measure endotracheal tubes in a canine patient. This patient is not sedated, so it is much easier to do it with a sedated patient, but we're going to demonstrate anyways. So it's important that you pre-measure before you do your induction process. So you want to have all your supplies ready and pre-measure those tubes before you get into the induction part of the procedure. So I have my 3 endotracheal tubes up here that are the 3 different sizes that I would anticipate using for this patient. I'm going to start with this tube here, and what I'm going to do, does it smell good? I'm going to try very hard to not have the patient touch the tube because I don't want to get her fur all over the tube because it will be getting into her airway. So I want to put the tip of the tube roughly where her thoracic inlet will be. So I'm going to palpate at the point of her shoulder up here, and I'm actually putting my finger in her thoracic inlet, which is going to be in the similar area from where I would be occluding for a jugular venipuncture. So I'm going to put the tip of the tube, so the patient end, around that area. Now, because she's awake, I'm going to have to sort of gently bend the tube a little bit to see how far it would be sticking out just past her nose. Because ideally, we want the airway connector to be just past the patient's nose. So you can see here, right where it says the jaw vet, that's technically where I should probably have, or just past that, where I should have that airway adapter. So for this tube, I would maybe have to trim this a little bit if it ends up being the right size diameter for her airway. Now, I don't want to mark this with a piece of tape because if that gets wet in the patient's mouth, it can fall off and it could get stuck at the back of their airway, and then after you extubate them, it could cause an airway obstruction. So some clinics will just put a little line with a Sharpie. I myself will just have that memorized for each tube. These larger tubes don't always have the graduations like the smaller tubes with the kitty cats and small dogs. So you do have to sort of visually remember where it is for each tube that you use. You can also make a little note on your anesthetic record if you find that helpful. Next, I'm going to take my middle-sized tube and do the same thing. So I'm going to pre-measure with all 3 tubes because they are different diameters, so I'm not sure which tube I'm going to end up placing and keeping in her airway. So I'm going to find that thoracic inlet and try not to let it touch her. If it does, and it does touch some of the fur, I'm just going to make sure that I take the fur off and make sure that the tube is clean. So you can see here with Asha, again, it's to about here, just past her nose. So a little bit long. I could always trim that and bring that airway adapter a little bit closer. Okay. Next, I have Asha. Next, I have this longer tube, which is my 3rd tube, and I'm going to pre-measure that on her. Asha, come here. I'm going to pre-measure that for her. She's making it a little bit easier for me now because she's in lateral recumbency. Again, if she was sedated, this would be a little bit easier, so ideally I would wait until my patient's sedated to do the pre-measuring. Now, I'm going to try to extend her neck the way it will be when I intubate her. Stay, sweetie. And I'm going to palpate that thoracic inlet. Now, Asha's making this a little bit more difficult for me right now, so I'd probably recheck this once she's sedated, but you can see that thoracic inlet to the end of her nose, this is quite a long tube. You can see there's quite a few inches that are going to be past the end of her nose. So I would ideally want to trim this tube much shorter or find another tube that is the same diameter but a shorter in length, just so I know that it's going to be the appropriate length for my patient. As referred to in the other pre-measuring video, a tube that is too long can cause increased dead space and also increases the chances of intubating down one bronchus instead of keeping the tube in the main stem bronchus. And a tube that would be too short, which in this case with Asha I didn't have, but if it was too short, it could risk dislodging, and if it moves a lot near the if it's short and it's near the oral pharynx, could cause irritation, swelling, and increased chances of not laryngeal spasm in dogs, but in cats. All right, so very important to pre-measure your tubes with your patient before you start the induction and intubation process.